Hello everyone, I am Dr. Ankit Madharia. I am an orthopedic and endoscopic spine surgeon from Raipur, Chhattisgarh. I am making this video to share my experience regarding treatment of sickle cell disease by using Mukherjee regime and some of its modifications. So this was an accidental discovery that I found out when I was treating some patients of avascular necrosis of hip who also happened to be sickle cell positive patients. And while I was treating them for AV and hip, their hemoglobin started to rise up. Their vaso-occlusive crisis suddenly disappeared. So the patients who required blood transfusion every 2 to 3 months would end up not having any blood transfusion for 2 years straight, just after starting this Mukherjee regime. So the target was not to treat the sickle cell disease, but it was to treat AVN. But I have found that since I treat a lot of patients with sickle cell disease in Chhattisgarh, which is a region which is endemic with sickle cell disease, which many of my patients, even in my personal family, who are suffering from sickle cell disease. So what I found that their hemoglobin has started to rise. Earlier it was 7 to 8, and now after starting Mukherjee regime, it has been consistently above 11 and 12. I've also been giving them hydroxyurea with that and soda bicarb in the form of tablets OBSs. And to my wonder, I don't know how it works, but I'm sure that the inflammation reduces with this Mukherjee regime, and this results in decreasing severity of vaso-occlusive crisis. And also we are giving some blood thinners in Mukherjee regime. So with that blood thinners, the chances of those RBCs, sickle cell RBCs, getting clogged in microvasculature are reduced. And this is just my theory. I don't know what is the exact mechanism, but reduced inflammation and reduced clogging of microvascular may be the reason why these patients are doing very well. And I have been closely monitoring because some of these patients are very close relatives of mine. Even my blood relatives are there whom I have been treating with Mukherjee regime, and I have been getting their blood test very frequently, and they are doing absolutely fine. So I was not earlier, I did not think that I would tell it to everyone before come to my, but since it was being discussed in our WhatsApp group, I thought to make a video because words would not have been sufficient to emphasize how beautiful and effective this Mukherjee regime is for management of sickle cell disease. And uh, most of my patients who are not even having AV and hip, I have started using this Mukherjee regime just for sickle cell disease, and their spine infarcts, different various bone infarcts have started to reverse, and they're absolutely fine. Their hemoglobins are perfect, their body weight has started to gain, and they're doing very well, extremely good. So this is a wonderful regime, wonderful drug, and it is very inexpensive for these patients for a country like India where the resources are scanty. So one must, I think someone from medical college should definitely do something to do some thorough research, at least do a trial for their patients only, because I have follow-up of more than 20 patients, but since I work in a private sector and I do not have resources to do all those trials. But this regime is very good. You must try it. I have more than 20 patients follow up. They are doing very well. So if you have any more questions, please feel free to ask in the comments. Thank you.